today's class is going to be on the sources and types of data. Okay, mainly we are going to talk about primary and secondary data today. See, when you do a research, you collect data. Okay, data is nothing but information. Okay, so it can be any type of information. It can be about a disease, about an individual, the age of a person is data, the sex of a person is data, the disease condition that a person is going through is data, the symptoms that the patient is undergoing because of a disease is also data. So every information that you collect from a patient or even a non-patient community member, anybody, for a research purpose is data. Okay, data can also be collected for non-research purposes for the sake of information gathering. Okay, so this government is informing the public about the number of people who died due to coronavirus, number of people who have been affected due to coronavirus, the number of tests that are being done for coronavirus. Okay, and of the number of tests, how many have tested positive, how many have tested negative. So all this information is data. So let us see the sources and types of data. Okay, so based on the based on which type of research you're doing and what type of data you get, we can categorize the data types. So basically the main two ways in which you can differentiate or classify data are primary and secondary data, as well as qualitative and quantitative data. Okay, so qualitative, quantitative data, primary, secondary data. So let us see what is quantitative data. Quantitative data is nothing but information that is in numerical form, which can be converted statistically, or it is in the form of statistics. Okay, so age of a person, the cost of a treatment, everything which is numbers is quantitative data. So quantitative data can be added or subtracted, and we can create statistics out of quantitative data. For example, how many people took part in a rally, how many people took part in an exam, how much did it cost for treating a leprosy ulcer, how much did it cost for doing a coronavirus test. So all these are numbers. Okay, and these are the types of data which are called quantitative data. Quantity, okay, it's based on the word quantity and quantitative data. So next is the qualitative data. Okay, qualitative data is any data that appears in written form or visual form or audio form, anything which is not numbers. Okay, information about a person, or about mental health, about newspaper data. Okay, news articles, interviews. So if you go to a patient and get information about their lifestyle, they will tell you something which is not a number. They will say, I eat in the morning, I eat in the afternoon, I eat in the night, then what food they eat. So this is not in numbers. The food that a person eats, rice, chapati, or vegetable, how much vegetable they eat, all this information is qualitative data. It is in the form of visual, audio form, or written form. Okay, so this qualitative data cannot be counted because it is not in number form. So it is information related to how a person feels. Okay, suppose you ask a person whether they are happy. See, information regarding a disease after they are cured of a disease. Example, leprosy patient or a HIV patient. You ask them after they have taken treatment whether they are happy, whether they are sad. So they will stay. Some of them will be happy that the disease treatment is over. Others will be sad because they are still suffering stigma. Okay, so this kind of information is qualitative data. So that is one way of classifying data or the type of data. The next way of classifying data is primary and secondary data. Okay, we'll see the secondary data first. Secondary data means it is data that a researcher does not collect, but it is already available from where the researcher can take out the data. Okay, it has been collected by previous researchers or the government, Okay, so suppose you go to a leprosy hospital like Karigiri and you want information about the number of patients admitted with ulcers in their foot, then you don't need to go and sit in the ward and find out every day how many people are coming. It is already available in the registers of the hospital, in the medical records department. So this is secondary data. Same way, if you want to find out how many people have died because of coronavirus in the last 2 months, you don't need to go to each hospital and find out the data. You just have to go to the government website and download the data, and from there you will get all the information. So the researcher who is doing research need not collect the information directly from patients, but instead they can collect it from other sources where the data is already available. So it can be government reports, newspapers, documents like diaries or audiovisual content. So these are sources of secondary data. Let us see the secondary source data sources in detail. First is government or semi-government publications. Every now and then the government publishes data regarding birth and death, regarding diseases, regarding coronavirus, regarding leprosy, how many new leprosy patients were diagnosed in a particular year, and of that number of leprosy patients, how many were grade 1 disability, how many had grade 2 disability, how many of them were children, how many of them were males and females. So all this information is available from the government database. Okay, similarly you can also get information during a literature review from previous research. Then you can get information from experts through their personal records. They would be maintaining records about like diaries, so that is a source of information. And you can also get information in the internet, newspapers, magazines. So these are called mass media. Okay, so all these are sources of secondary data which can be used for research, but you have to ensure that you cite or give credit to the people who from where you have obtained the data. Then primary data. Primary data is the data that is collected by the researcher himself or herself. Okay, so as a medical sociologist, if you are doing your research, then you will create a questionnaire, or you will have an interview method, or you have other methods of data collection, and then you get information from patients or health workers or anybody. So all the data that you get directly from the research subjects are called primary data. Okay, so you can use various methods which we will see each of these in detail, either a questionnaire or an interview or an observation. So each of these methods, when you collect data as a researcher, then that data is primary data. Hope you understood the primary and secondary data, qualitative and quantitative data. So these are the various sources of data. So next we'll see about the research tool, which is the next topic. So basically, as introduction, I'd like to say that research tool is nothing but a research instrument. Okay, both tool and instrument are the same. So how do you do research? So the method in which you collect data after when you do research, that is the research tool. Okay, so we will be seeing each of these methods in detail, each of these tools in detail later on. The first thing is observation. Observation is looking at something or someone. So observation is one method of one type of research tool. Then interview, having an interview with the patient or your research subject. The research subject could be a health worker, it could be a teacher, it could be a patient, it could be a doctor, whoever it is. So if you interview the people who are your samples, then that is one source of that is one research tool which you can use for data collection. Then you can use questionnaire as a the questionnaire, the observation and interview are methods of our data research tools. Okay, next question is, as a researcher you create questionnaires which you give for patients or other people, other samples, and you collect the questionnaires. So these are all research tools which can be used for data collection. Okay, so the first thing you have to do in any research is to make this research tool. You have to make a form for your observation, what you are going to observe, or an interview schedule, or a questionnaire. This has to be made or constructed by the researcher. So this will be based on what kind of data you want to collect for your research. Okay, then the next thing is you have to use the interview form or questionnaire form or observation form with a small number of samples. Okay, this is called field testing or pre-testing or a pilot study, where your tool, your research tool, which is the form which you have created, is tested in a small number of patients or samples. Once you test it on a small number of samples, you will be able to understand whether your tool is effective and whether it is valid and reliable and all the other things. So once you know that it is a good tool, then you can use it for the whole study population. Then you will not face any problem during the research or during the stage of analysis. Okay, so that is the reason why research tools like interviews, forms and questionnaires, they have to be used in a pilot study or field tested or pre-tested. So that is very important. Okay, so let us see what are the criteria for a good research tool. We have seen what are the research tools that can be used, and as a researcher you will construct the research tool and you will also field test the research tool. So we have to see what are the criteria that are important in a good research tool. The first thing is the validity of the research tool. Okay, validity is an important word that you will keep coming across during research. Okay, so validity actually means it measures what it is supposed to measure. Okay, so that means if you are studying the cost of a leprosy ulcer, then it has to measure the actual cost of treating a leprosy ulcer. Okay, it should include all the direct costs if you are using the tool for calculating cost. So in case the family member is taking leave or taking off from the work to bring the patient to the hospital, even that is a cost which is involved in the treatment of leprosy ulcer, because the patient has to undergo that cost also. So in simple words, a tool has to measure what it has to measure, then it is called, it is valid. So validity is the most basic thing that any research tool should have. So you can actually categorize the validity as high validity, moderate validity, or even low validity. So it's a very specific way of assessing the research tool. Okay, so the next criteria for a good research tool is the reliability. So again, just like validity, reliability is very important in research. And reliability means nothing but consistency. Okay, that is, each time you do the study, it should be consistent. The values that you get out of the study should be consistent. So then your research is valid. Okay, so for example, if you are studying about whether smoking causes cancer and your study says smoking causes cancer, okay, then that is the answer. In the first study, your results say smoking causes cancer. Then when you do a similar study after 5 years, if it says smoking is not the cause of cancer but pollution is the cause of cancer, then your study is not reliable because it is not consistent. It is giving a different answer at a different time. So the test which you use or the tool that you use for the research should be reliable in different groups in different points of time. Okay, for example, if I give a test, your entrance exam, and you all scored good marks and you join the college, after you join the college also your grades should be good, then only the test that we conducted is reliable. So a good student will always be a good student. So That is the reliability. So it should be consistent. Your answers in the research should be consistent. If you use the test, like if you another example I can give you, if you are checking the reliability of a BP machine. Okay, so we are checking the BP for a patient in the morning, and after another half an hour, and after 2 hours, and the patient has not had much of walking and is in the same position, maybe a patient in the ward lying down. So the BP, unless it shows similar values, then it is not reliable. If it shows the same value, it is reliable. Okay, if the patient is not a BP patient, okay, I think you should understand clearly that, because I'm just trying to make it more clear to you. The patient is not a BP patient, he is a normal patient. Okay, so the BP should be normal at all times. In that kind of patient, you are testing the blood pressure at different intervals. So if the machine shows similar value, then it is a reliable machine. If in a patient who has no BP, the BP shown by the machine is very high, then it is a wrong machine, it is not reliable. So that is the meaning of reliability, the consistency of a test. Okay, so a good research tool should be consistent and reliable. The next thing is the objectivity. Okay, objectivity means there should be no bias in the research tool. So for example, if you have a multiple choice and one of the choices is correct, or if you ask the patient questions like whether something is true or false, then the answer will be very objective. For example, do you have corona? Do you not have corona? There is only yes or no. So it's a very objective question. So there is no bias in the answer, or the judgment of a person is not involved. It is a very objective thing. That is why multiple choice questions are called objective questions, where the answer is to the point and there is no deviation or bias in the answers, and the answer is accurate and reliable. So this kind of tools should be selected for your research. Tools which are objective, which measures what it has to measure in the right way without any bias. Okay, the next criteria for a good research tool is the adequacy. Okay, what is adequacy? Adequacy means what needs to be measured has to be measured. You cannot measure 100% of whatever is needed, but what is relevant for your study, that has to be measured by your research tool. So that is the adequacy. What is needed for the particular study has to be measured by the research tool. So that is adequacy. Then finally, usability. Okay, usability can also be called practicability. Okay, practicality. Okay, you have heard people saying it is not practical. Can you say tomorrow I will be going to the moon? Is it practical? No, it is not practical. Okay, so same way, a research tool has to be practical in its usage. It should be useful and effective in its function. Okay, for that we can see how it can be practical. First is the ease of administration. So the way in which you give the test, or the data is collected from a sample, there should be ease. That is, it should not be difficult in collecting data. So the administration means giving and collecting the information. So collecting information should be easy. Then ease of scoring. If you are giving a score, if it's a quantitative data collection, if you give a score for each right answer 1 mark and each wrong answer 0 marks, so that is an easy way of scoring. You cannot complicate it by saying -1, +1, and all these kinds of wrong scoring should not be there. So scoring should be easy. Then the ease of interpretation. Once you have made the test results, it should be easily understood. So for example, are you cured of coronavirus? Yes or no? Or undergoing treatment? These should be the 3 options. So it's easy for us to understand whether a person is cured or not. Or if the next question can be, if you are undergoing treatment, are you in the ICU, are you in the general ward, are you at home quarantine? So that can be next choice. So it's easy for us to understand or interpret the answers. Then the next thing is economy. So what is economy is the cost. See, in any research, the cost is a barrier. So we have to ensure that the research tool that we use is economical. It does not cost a lot. Okay, so if you have a questionnaire, if you make 100 pages questionnaire, then you will have to Xerox 100 pages, or you have to photocopy 100 pages for each sample. Whereas if it's a 2-page questionnaire, it reduces the cost. Same way, there are other ways in which you can reduce the cost. Instead of having gap of 5 lines between each question and answer in a questionnaire, you can have the answers on the same line, or reduce the gap, reduce the font size. So these are ways in which you can have economy in the research. Then the last thing is having equivalent forms. So equivalent forms are nothing but the test items which are similar in content and level of difficulty is the same and other characteristics are the same. So one form can be substituted for others. So equivalent forms is very useful in the practical aspect of research tools. So instead of using the same form, you can use a equivalent form. Okay, another form which is equivalent, which measures the same thing which you are planning to do in your research. So you can substitute one form for the other. This is also very practical, and these are the various criteria: reliability, validity, then practicability. So these are ways in which you can select a good research tool. So that is very important for the success of a research, and you will also, as a researcher, you will be able to complete the research in a proper way. It will have good effect and good validity. It can be published as a good research paper. Okay, so we will see more about in detail about reliability, validity, because they are much more important. We will see about that in the next class. Thank you.